That's my daughter, Joy. She just turned 9 this month, and she is doing her lesson. I'm going to walk outside because it's so dark in here. We're inside. Hold on. This is actually the inner stadium. I don't know what you call this. Stable. The inner stable. She's out there. I'm going to go outside. And it's a nice, bright, sunny day here in New Jersey. We're at Baymar Farms. And I'm going to walk a different direction today. So I think I'm talking normally. I'm still a little bit swollen on this side of my face. I had my wisdom tooth extracted on Wednesday, which is today's Saturday, so 3 days ago, because I had a huge cavity. It looked like a pirate tooth, big black tooth, 80% black. It's horrible. I'll show around. And my tooth is still hurting quite a bit. Yesterday was bad. Lots of pain yesterday, but I kept the office hours. Just made them light on Thursday and Friday. But I'm glad I did, because I saw a lady like yesterday who was in a lot of pain. She had an abscess, so I'm glad I went ahead and went in despite not feeling well. It's really nice out here. So I said I would speak on, show this way too, on preterm delivery. I started on preterm delivery, and I'm going to continue. So to give I'll try giving a quick recap. The quick recap is preterm labor, preterm delivery. So preterm delivery is any delivery before or under 37 weeks gestation. So 37 weeks of pregnancy. Full term is 40 weeks, but between 37 and 42 weeks, so 2 weeks after we give a due date and 3 weeks before the due date is considered full term. So before that, 3 weeks before the due date, or under 37 weeks, is preterm delivery. Let's see. I spoke I think it was Thursday. I spoke Thursday about the different risk factors. The main one is most women who have a preterm delivery, they don't have any potential risk factors. It's out the blue or de novo. And then if you've had a preterm delivery before, that puts you at a high risk for subsequent preterm deliveries, each a little bit earlier. And then anything that compromises the cervix, the uterus, so anomalies or defects of the cervix or uterus, multiple surgeries or previous surgeries of the cervix, drugs, medical conditions, hypertension, sometimes diabetes. Those can be potential causes or risk factors for preterm labor, preterm delivery. And let's see, one screening method or a monitoring method that we can use is to do an ultrasound or a sonogram after 14 weeks. So predominantly one is done at 14 weeks to see if the cervix is getting shorter and or if the cervix is starting to open. So the cervix should be 1 inch or 25 millimeters or longer, and it should be closed on the ultrasound. If we see funneling, which means it's opening from the top down, it looks like a V or a funnel, then that indicates that that person is at an increased risk of preterm labor and preterm delivery, because the cervix is looking weak. It's starting to open, and usually the cervical length is shortening at the same time. So twist this around. So ultrasonic screening at 14 weeks is a good indicator. And then oftentimes, even if everything is perfect, normal, at 14 weeks, if there's any concern or any potential risk factors are present, then another sonogram is done between 18 and 22 weeks. And if there's a concern at 18 to 22 weeks, then that increases obviously the likelihood of preterm delivery, preterm complications that result. So an additional testing is done. The additional testing is usually something we call FFN, or fetal fibronectin. Now, fetal fibronectin is a protein, poor sounds. Fetal fibronectin is a protein that basically is the glue to hold the uterine lining to the amniotic sac. So if the uterine lining and the amniotic sac are normal and intact, there isn't any release of that fetal fibronectin. If the amniotic sac starts to pull away, or starts to basically pull away from if the sac starts to pull away from the uterine lining, then that fetal fibronectin is released. And when it's released, we can pick that up on testing. Some more riders here. We can pick that up on testing. And a couple of the owner's dogs are right there. So we do a vaginal cervical swab. If we pick up fetal fibronectin on the swab, it's positive. That indicates that that person is at a high risk of delivering prematurely, usually within 7 days of that positive test. So it's a highly strong, what we call positive predictive value. If that fetal fibronectin test is done and it's negative, then that gives us about a 2-week breathing period, because on average, even if someone does deliver prematurely, it's more than 2 weeks after a negative fetal fibronectin, or FFN. So a positive FFN indicates that delivery is highly likely to be imminent within 7 days, and a negative indicates you have probably a good 2 weeks, and measures can be taken in that time frame if it's positive to try to decrease the risk of actual labor, delivery, or to potentially improve the outcome of the baby who might be born early. So as a quick recap, there are risk factors, but those risk factors are kind of loosey-goosey. The predominant risk factor is having a previous pregnancy that was delivered early, and early is under 37 weeks. And I mentioned on Thursday that late preterm delivery is 32 to 36 weeks and 6 days. Early is 28 to 32, and extremely premature is under 28 weeks. And as a perspective, legal abortion for most states can be done up to 25.5 weeks, and then 2 weeks later it would be a preterm delivery that we'd be trying to save. So that's why extremely preterm is under 28 weeks. So if someone's at an increased risk for preterm labor, preterm delivery, then we can do an ultrasound to check the cervical length and to check if the cervix looks like it's opening. Then we can do a swab if there's a concern. We can either do the swab in addition to checking the cervical length, or we can do it if the cervical length looks like it's short, which short is less than 25 millimeters or less than an inch. And if that swab for fetal fibronectin, which is basically the glue that holds the amnion to the uterus together, if it's positive, that tells us that that person may deliver within 7 days. If it's negative, it tells us we might have 2 weeks. And obviously reasons for the fetal fibronectin being positive are going to be, if there's separation, it's going to be because there's contractions, and with the contractions, the amniotic bag or the bag of water is being pulled away. Or if there's an infection, because an infection can also cause subtle contractions or spasming of the uterus, because the muscles of the uterus become unstable and that can start to separate the lining. Or if there's any kind of issues with the placenta, any kind of bleeding issues with the placenta, or any issues where the placenta is starting to separate because there's spasming or contractions of the uterus. Lots of different reasons, but all of those reasons together are going to indicate that the pregnancy is not stable and that preterm labor may ensue. Obviously, not everyone who goes into preterm labor has a preterm delivery, but if someone has preterm delivery, more likely than not, they had some degree of preterm labor. Even women with cervical incompetence or cervical insufficiency, where the cervix is weakened, either just naturally because they have a collagen or tissue makeup disorder, or because they've had multiple surgeries, multiple D&Cs, or they had surgery for severe precancer, so we had to cut out a lot of the cervix. Even then, it's thought to be contraction-less, so no contractions, the cervix just starts to open. But as the cervix gets to a certain degree of opening or dilatation, you can see contractions. So all of those factors put together allow us to see or to monitor or to determine if that person is at a high risk of preterm labor / delivery. So that's the wrap up for today. This is Dr. McDaniel at the horse farm where my girls take their lessons every Saturday morning. And tomorrow I'll speak more on preterm delivery. Thank you for watching. Have a great rest of the day. Bye.